Welcome, everyone. Thank you for joining us today. Um, we're going to get started right away because this topic is um, very much in demand, and we're looking forward to an amazing webinar. Thank you for joining today's webinar. Before we begin, I'd like to cover a couple of technical issues. If you come across any problems during the course of the webinar, please chat to the host. And the chat box you can find on the right lower hand side of your screen. We're also going to ask you during the webinar, so you will all be muted throughout the course of the webinar, but during the webinar you can chat your comments or questions in to Dr. Steele as we move ahead, and we'll compile those questions and comments and address them at Q&A at the end. So again, thank you for joining, and let's get started. On behalf of the Community Technical Assistance Center of New York, it is my pleasure to welcome you to today's webinar, Healing the Hidden Wounds of Internalized Racism. My name is Jim Rodriguez, and I'm the Director of Trauma-Informed Services at the Community Technical Assistance Center and the McSilver Institute for Poverty Policy and Research. And I'll be moderating today. And today's webinar, of course, as the title suggests, is going to focus on internalized racism. As the United States finds itself yet again in the throes of a racial reckoning, efforts to dismantle racism should include all its forms, including internalized racism, and clinicians and therapists are in a unique position to address this most insidious form of racism and oppression. So in searching for materials on this topic, I came across an article by today's presenter, Dr. Janae Steele, and we're happy to have her. Dr. Janae Steele is a licensed professional counselor, educator, and diplomat of the Academy of Cognitive Behavioral Therapies. Dr. Steele is also the co-owner and clinical director of Kalamazoo Cognitive and Behavioral Therapy, LLC, where she provides therapy, supervision, and training in CBT. Her scholarly activity includes work focused in the areas of CBT, social justice advocacy, and counselor training. The article I mentioned, her most recent article published in the May 2020 issue of the International Journal of for the Advancement of Counseling and Development, describes cognitive conceptualization and treatment planning using CBT and a proposed cognitive model of internalized racism. That article was titled CBT Approach to Internalized Racism Among African Americans. And today she will expand somewhat on the topic to address issues related to broaching the topic and directions for intervention. So with that said, I'd like to turn it over to our presenter, Dr. Janae Steele.
All right. Thank you so much for having me here today. And I too want to welcome everyone who has joined us in this webinar. And I also want to thank you for your attention to this topic. Generally, as clinicians, we recognize that culture and race is a significant factor influencing therapeutic relationships and even client outcomes. However, there's also the reality that talking about these things can be somewhat uncomfortable, right? Like if you think about your own work with clients, how many of you have worried about offending your clients by bringing up race? Or how many of you have brought up race, but maybe done so in a way that's clumsy or only superficially addressed the topic, but really didn't explore like the depth of racism, internalized racism on the client's well-being and the presenting concerns that they're sharing with you during therapy. So today I want to address some of that discomfort that we might feel addressing race and racism in therapy with our clients, but then also talk more specifically with you about how we can begin to conceptualize and integrate internalized racism into our treatment treatment plans with clients of color, and particularly African American or Black clients. So then to that end, my objectives for this presentation are to explore factors influencing the development of internalized racism among African Americans, to explore the relationship between internalized racism and psychological distress among African Americans, to discuss therapist dispositions necessary to address the issue with African American clients, and then also to explore CBT as a way to understand and deconstruct the impact of internalized racism with African American clients. Okay. So I've already mentioned, acknowledged that conversations about race and racism can be difficult in our work, but also personally. So I've done my best not to include any images that might be too triggering, but I just also want to remind you, as you're listening to the topic of this conversation, just remember to take care of yourself. If you're a target of racism, be aware of anything that might be triggering or overwhelming. If you should encounter any of those things, try to use mindfulness, your breathing skills when you need to. If necessary, take a break. If you're an ally or someone who's just learning about this topic, work toward maintaining a non-judgmental stance as you're listening today. Try to recognize any defensiveness that might arise within yourself, and then always seek to understand what's being discussed, and feel free to ask questions. That's why we're here. This is a non-judgmental place. We're all here to learn and to grow together. So with that in mind, I wanted to begin with this photograph. This is a picture of me, my sister, my mom, and my dad. And you can see that my sister and I are presented here with our babies, our baby dolls, and we're smiling. As I think back to receiving that first Black baby doll pictured there, I was not smiling. It was Christmas Day. I was about 5 years old. I had been wanting a Cabbage Patch doll. I was very excited when I saw a big box under the tree in the shape of the Cabbage Patch doll box. So I excitedly opened the box, saw that it was a Cabbage Patch doll, but to my disappointment, it was a Black Cabbage Patch doll. And my father actually took a picture of that moment of me opening the box, and I looked so sad. And I remember as a 5-year-old being disappointed because the doll was Black, and feeling that the doll was not as pretty as the white doll that I wanted. And so I share that story with you just to illustrate how deep-rooted issues related to internalized racism are for people of color. It begins at a very young age. It's something that we're not consciously aware of, and it's something that influences how we see ourselves and the way that we interact with the world. Luckily, it was my uncle who bought me this Cabbage Patch doll. My parents were buying me white dolls, but my uncle bought me this Black Cabbage Patch doll. And it was this same uncle who, maybe when I was around 8 years old, he bought me a book called Lessons from History, Celebration of Blackness. And in that book, it talked about Africa, and it talked about Africa in a positive light. It talked about accomplishments that were made by people from Africa throughout history and in contemporary times. It talked about the beauty of our hair, our skin, our cultural norms, and it really had a positive effect on how I saw myself, and really sparked the development of a positive racial identity for myself. And so as we're thinking about work with clients, I would like to encourage you to remember that while issues related to internalized racism can be very deep-rooted, sometimes all it takes is someone to speak positively about a person's racial or ethnic identity, and someone to acknowledge the difficulties that they're going through as it relates to race. Okay. So then with that in mind, I would like to just quickly read you all some statistics exploring the broader psychosocial context of race and African-American mental health. African-American adults are 20% more likely to experience mental health issues than the rest of the population. And in spite of that, only 25% of African-Americans seek treatment for a mental health issue, compared to 40% of white individuals. The reasons for this drop-off include misdiagnosis by doctors, socioeconomic factors, and a lack of African-American mental health professionals. And so this becomes important when we're thinking about being able to relate to an African-American experience, or at least being comfortable exploring the African-American experience with your clients. Adult Black or African Americans living below poverty are 3 times more likely to report severe psychological distress than those living above poverty. Black African Americans are less likely than white people to die from suicide as teenagers. However, Black or African American teenagers are more likely to attempt suicide than white teenagers, and that difference is 8.3% versus 6.2%. Only 6.2% of psychologists, 5.6% of advanced practice psychiatric nurses, 12.6% of social workers, and 21.3% of psychiatrists are members of a minority group. And according to the National Association on Mental Illness, only 3.7% of members of the American Psychiatric Association and 1.5% of members in the American Psychological Association are Black. African Americans of all ages are more likely to witness or be victims of serious violent crimes. Exposure to violence increases the risk of developing a mental health condition such as post-traumatic stress disorder, depression, and anxiety. African American children are more likely than other children to be exposed to violence, which can have a profound long-term effect on their mental health. And some African Americans even see mental illness as a punishment from God. Up to 85% of African Americans describe themselves as fairly religious or religious, and they commonly use prayer as a way to handle stress, according to the American Psychiatric Association. And so then when we're thinking about this psychosocial context, we can see that there are a multitude of factors forming that relationship between race and mental health for African Americans. And those factors really can be broken down into 3 main areas. There's a lack of cultural sensitivity or representation in services. And so again, that is important because clients need clinicians who are going to understand and be able to initiate these conversations. Again, we're socialized in a society that tells us it's rude or offensive to bring up race. And so it's much less likely that the client is going to initiate those conversations, in spite of the fact that a majority of African Americans experience psychological distress due to race. And so because the clients are less likely to bring it up, it's incumbent upon the counselor to do that. And when that doesn't happen, clinicians are often viewed as less credible by their clients, and there's often a premature termination that happens as a result. Beyond that, there are also cultural norms within the African American community that contribute to stigma around mental health or receipt of mental health services. So that's another barrier that we as clinicians might face when working with African Americans. And then lastly, there are social cultural factors that contribute to psychological distress or even trauma that might lead an African American person to seek counseling. And so it's important that we're aware of those sociocultural factors and not only recognizing them as precipitants of trauma, but also the result of a client's direct experience with racism. Okay, so then thinking about those social factors a little bit more, we can see that societal influence in particular provide that context for internalized racism among African Americans, and some of those societal influences include the historical legacy of slavery, segregation, Black codes, but then also modern day aspects of racism, such as colorblind racial attitudes, microaggressions, the media, and white supremacy. And so, just for shared understanding, as we're talking about colorblind racial attitudes, we're referring to attitudes that either minimize or negate the impact of race on a person's experience. So these are statements such as, when I look at you, I don't see race, or a person's race doesn't matter. All that matters is if they're willing to work hard and achieve their goals, right? So those types of ideals negate the impact that race has, or racism has, on a person's ability to have access to resources, to be provided opportunities, and it prevents one from addressing the racism that's creating those barriers, because we're working under a supposition that race doesn't exist, isn't important. When we're talking about microaggressions, we're looking at like subtle, unintentional slights, insults that, again, undermine a person's racial experience. And sometimes these things are even meant as a compliment, but they still work under this implied racial hierarchy between people of color and people who belong to the majority group. So an example of a positive microaggression might be telling an Asian person, for example, that they speak so well, right? Like, so they speak without an accent, or telling a person that their hair looks nice for them, or speaking loudly, even when you're talking to a blind person. So these are all things that are often well meant, but they have the impact of minimizing a person's personhood, or just being outrightly offensive. In terms of the media, that's an important factor to consider, because again, the images that we see on TV, other aspects of media are largely how we are socialized into our society, into culture. And so throughout time, although there's a lot of positive work being done now, but the trend has been that people of color, African Americans in particular, have been portrayed at the bottom of a racial hierarchy. So being portrayed as things like criminals, uneducated, sexually promiscuous, there to serve other people, whether that be like if you're looking at an old movie through slavery, or even like a newer movie in terms of The Help, or even if it's a friend relationship, it's still there in a supporting role to the white character. And then finally, when we're talking about white supremacy, we're looking at the underlying framework that rationalizes social and racial disparities. White supremacy depicts African religion and customs as savagery, demonizes African skin color and phenotypes, and idealizes white beauty, language, and cultural norms. And white supremacy depicts white culture as the ideal for humanity and confers structural power and privileges to white people as a group. Through white supremacy, white people have freedom from the psychic weight of race to move freely in most spaces and to be reflected as the norm in nearly all aspects of social life. So, I think one way that last point is commonly illustrated might be if you ask a white person to identify the cultural norms associated with their race. They often have a very difficult time. As I mentioned, I'm a counselor educator, so quite often I teach multicultural counseling classes, or have conversations related to culture in other coursework across the curriculum, and discussing these issues. Students struggle, right? They struggle to identify what it means to be white, because being white is seen as a universal experience. Sometimes I'll get responses like, I'm just American, or I'm just white, so I don't have a cultural identity, or I don't know my ethnicity. Like some people know that they're Irish or Italian, and I don't know, so I don't really have one. So white people are really kind of through white supremacy viewed as a standard for humanity, and all other groups are viewed as normal, and that carries along with it like some psychological oppression, which can have an impact, create psychological distress for people of color. When thinking about white supremacy, it is important to remember that this is an ideology, right? So it's not something that we're always consciously attempting to convey or even articulate, but it's like the way that we've been socialized to think and view our experience just by virtue of being born. And so if we're thinking about white supremacy, it can be helpful to think about it in terms of impact rather than intent. I think there are probably few people who intend to be white supremacist intentionally, but because it's the way that we've been brought up to think, all people, white and people of color, it influences our worldview. So then with white supremacy in mind, I think it's also important just to discuss some specifically about how we're defining racism. Racism is a race-based form of oppression backed by legal authority and institutional control. Racism differs from prejudice in that prejudice may be defined as stereotypes, attitudes, and generalizations about individuals from a particular social group, while racism reflects systemic limitations to economic and social goods and power. Again, racism is not reflective necessarily of a person's moral character or intentions. Instead, racism reflects the impact of one's behavior in terms of maintaining systemic race-based inequities. So again, we're looking at impact versus intention. Often the things that we do or we say are not meant to be racist, but they have that impact essentially by either reinforcing an ideology that places people of color at the bottom of a racial hierarchy, or presents real life barriers to access to goods and resources for people of color. Some examples of what that might look like are included here. Ibram Kendi, in his book, How to Be Anti-Racist, has a really in-depth conversation about racism, and he identifies several ways that racism might be manifested. I've included a few here, but there are many more, so I definitely recommend that you read the book. The first is cultural racism. And so that's when we use cultural standards to impose a cultural hierarchy among racial groups. And this is probably what we think about most commonly when we're thinking about racism. So it's like maybe comparing African-American dialects of speech to a more standard American dialect or white American dialect of speech, and viewing the African-American vernacular as less educated, or the person using it might be seen as less intelligent than the person who's able to speak standard English. Biological racism, so the idea that the races have meaningful differences in biology and that these differences create a hierarchy of value. And so we can see biological racism kind of in two ways. The first might be attributing characteristics like intelligence to race. So believing that some races are less intelligent by nature. And, those are ideas that supported the eugenics movement for a while in our country, supported things like inequities in education. But then there are also things like believing that certain races are more naturally gifted or talented at certain things rather than recognizing that a person has a practice skill that they've developed. So things like sports or dancing or maybe even cooking, right? So things that we're attributing to race, but really it's a human experience that a person has practiced and developed. Next, we have bodily racism. So that's perceiving certain racialized bodies as more animal-like and violent than others. And this has really become an issue over the past couple of years as we're thinking about police brutality and the mindset that leads police officers into perceiving the African-American people that they're encountering as threats, right? So we've been socialized into believing that darker skin represents a threat. And so more aggressive action is taken toward these people, sometimes resulting in death or serious harm. And so that's an example of bodily racism. Ethnic racism is racist policies that leads to inequity between racialized groups, and it's substantiated by racist ideas about racialized groups. So this sometimes I think it's seen in our immigration policy. So we're more willing to have certain groups in our country. We're more willing to admit them, but it's also seen in ethnic differences among individuals within the same racial groups, right? So based on the white supremacy ideology that we've been socialized into, we might, even as a member of the same racial group, look down upon other ethnicities. Among the Black race, for example, there are sometimes disagreements between African Americans and people from Africa. People from Africa viewing African Americans as lazy, entitled, African Americans imposing those savage, uncivilized stereotypes onto Africans. So those are two ways that ethnic racism kind of plays out in our country. And then we have colorism, and that's, pretty self-explanatory, but those are policies that's policy and ideas that leads to inequality between light and dark people. So basically it's where people with lighter skin, people with a closer proximity to whiteness are viewed as more valuable and actually treated as such by people of color and by white people. In the African American community, some ways that colorism has been shown throughout history has been maybe in terms of admittance to social clubs. So there were some times, maybe like in the 1920s, where people were having brown bag parties and no one with skin color darker than a brown paper bag could be admitted. Or even if we're looking at like celebrities and entertainers today, it's usually the people with lighter skin, lighter eyes who are viewed as more valuable, and those people are able to have greater crossover appeal to people of color as well as white people. And then lastly, I've noted internalized racism here, which is a negative view of self based on the perceived inferiority of one's culture. Okay. So I think it can be helpful to think about internalized racism within the broader context of racialized trauma. Racialized trauma refers to mental health and emotional injury caused by repeated encounters with racial bias, hostility, discrimination, or harassment. Common ways people are exposed to racialized trauma includes small everyday slights, such as being followed around a department store. So again, referring back to those microaggressions, direct racial slurs, denied opportunities. So for example, not getting the promotion, not receiving the loan, not being accepted into a graduate program. Then there's racial profiling, and there are also hate crimes. And it's important to note that racialized trauma may happen as a result of a direct or indirect encounter with a race-based event. So you might experience it yourself, or you might witness it. And so then as we're thinking about the impact of racialized trauma and how we might explore it and assess it in our work with clients, it can be helpful to keep in mind 3 specific types of trauma. The first is historical trauma. And so that refers to psychological distress experienced by a group of people over time and across generations. So an example within the African American community might be the collective pain that we felt with the murder of Trayvon Martin and Tamir Rice in light of the historical murders of other young children or young adults like Emmett Till and the 4 little girls in Birmingham, Alabama, with the bombing of the church there. So those are things that many people living today didn't witness, but that's part of our historical memory. And so when similar things happen, they hurt because it brings up that collective historical pain from the past. Then there's also transgenerational trauma, and that is pain transmitted across generations due to events that occur within an individual family. So for example, having a parent or a grandparent who was a victim of police brutality. I can think about a woman who I admire greatly at our church. With the death of George Floyd, she shared with us that that was particularly painful to see because her brother was murdered by the police. And so this is a 60-something-year-old woman, who is still experiencing that pain and that hurt over having something similar happen to her own brother. So, it's these things aren't disparate. They aren't infrequent. There are things that are happening within African American families and within the community, and they have a lasting impact on the collective pain that we feel. And then lastly, there's vicarious trauma. And so that's trauma that occurs as a result of learning about or witnessing racism or prejudice targeted at other Black people. An example might be witnessing other Black people being bullied or called racial slurs. More recently, witnessing incidents of police brutality or vigilante attacks or other things similar on social media. Around the time that the pandemic hit was also around the time that we were experiencing an increase in these incidents in the media. I'd say my caseload was about 90%. I'm sorry, I saw a question pop up in the chat and it distracted me. So I'll continue with this and then I'll respond to that question. Around about 90% of my caseload was African American, and they experienced witnessing that trauma, or excuse me, those deaths as a traumatic event, right? So as if it happened to themselves. So many of my clients, for those few weeks and months after those events were broadcast on the news, they had trouble sleeping. They had anxiety. They felt depressed. They had trouble relating to people at work. They were feeling a sense of isolation. They were wanting to withdraw. They felt afraid for their physical safety. They felt afraid for the safety of the people that they care for. So that vicarious trauma, when it's so repeatedly broadcast through our media, can have an especially significant impact on the racialized trauma that African Americans are experiencing and the psychological distress that they might present with during therapy. I think there was a couple of questions about post-traumatic slave syndrome. I cannot talk very articulately about that because it's something that I don't particularly ascribe to myself. So I think that there's this idea that there is a sense of trauma that's carried through African American people as a result of slavery. I'm not so sure how I feel about, and it's not just trauma. It's there's this idea that the way that African Americans move through life is informed significantly by the history of slavery in the African American community. And I just personally am not sure if I believe that. I'm not so sure that we're defined by slavery as much as that as a people, but I do think that our country and the systems that have an impact on our lives are defined by that history of slavery. But I don't think it's something that's within or at the core of who we are as a people. Yep. And so then there's another question about responding to people who might deny some of this. I think something that can be helpful is to provide them with simple statistics, or I think the most effective thing is experiential learning. So sometimes if people have a difficult time believing these things, it's because they don't know anybody who's impacted by it. And so if you can encourage people to expand their social groups, that can be an effective intervention as well. So then looking at internalized racism a little bit more specifically, it's a negative view of self based on the perceived inferiority of one's own culture or race. And it comes from accepting negative racial stereotypes about oneself. But it also happens as a result of adopting beliefs about the superiority of the beauty, language, cultural norms, and traditions of white people. And you can see in this word cloud that I've included on the left-hand side here, that these are some of the consequences of internalized racism. People often experience a sense of alienation. They might have low self-esteem. Research shows that internalized racism is correlated to low career aspirations. It's related to low confidence, depression. It also increases the depression, anxiety that people might experience. It can create a sense of shame. It can lead to self-degradation. And so these are all things that we're thinking about commonly when we're conceptualizing internalized racism. But it's also important to differentiate internalized racism from other similar constructs like low self-esteem, because internalized racism leads to, what differentiates it is that internalized racism leads to adopting ideas and behaviors that reinforce racial oppression. So either internalized racism makes a person adhere to these ideals derived from white supremacy, or it actually leads to them engaging in behaviors that reinforce racial oppression. This is a chart, and you all will have the PowerPoint, so you could look at it more closely once we're concluded with this presentation. But this describes some of the psychological processes that are undergirding internalized racism. This will be published soon, I hope, in the Journal of Mental Health Counseling by myself and one of my colleagues. And so here we've kind of broken down some of the core beliefs and schema, as well as the compensatory strategies that are associated with internalized racism. Remembering that core beliefs and schema, those are the beliefs that we have about ourselves and the world. So with internalized racism, there can be a schema or a core belief of inferiority. That might be believing either consciously or unconsciously in the supremacy of white culture. Being Black is at times embarrassing or shameful. And then also inadequacy, ascribing to personal inferiority beliefs around being Black. So for example, thinking I'm not good enough, I can't be successful unless I adopt certain interests, communication styles, and standards of beauty. I just want to highlight those two because I think, again, if we're thinking about this, psychological phenomena that people are discussing in therapy, that those two might be some of the most common. And then when we're thinking about behavior that reinforces racism, we can look at some of these compensatory strategies. So things like avoidance, attempting to cope with feelings of shame, embarrassment, and alienation by distancing oneself from aspects of one racial group membership. For example, concealing the neighborhood one is from, or isolating oneself from individuals in social settings perceived to confirm negative stereotypes. Also conformity. So adjusting one's speech, appearance, and behavior to be more similar to the dominant culture, ranging on a continuum from code switching to overt stigmatization of one's cultural norms. Overperformance, so believing that you have to always achieve higher in order to meet a minimal, to receive a minimal level of acceptance from others, or even learned helplessness, which is when we do nothing because we perceive that whatever we do will have no effect anyway. Okay. So then, we can understand all of these things conceptually, but we've already, acknowledged that there's a challenge when talking to clients about race. It can be uncomfortable. It's often a sensitive or hot button topic. Many therapists fear that they might offend clients, or they haven't been trained to have these conversations. And the impact of that is that those clinicians are viewed as less credible. They may experience ruptures in the therapeutic alliance, and they may have worse therapeutic outcomes. So then when thinking about how we can address that challenge of talking to clients about race, it's important to think about it maybe like in a twofold fashion. First would be developing specific dispositions and skills necessary to address race. Multicultural orientation provides a useful framework for thinking about how we might do that. And then also looking at how we integrate constructs concerning race and racism into conceptualization and treatment planning. This is a quick graphic that I wanted to share with you about multicultural orientation, just in case you're not very familiar with it. It's kind of, I guess, where we would look at the advancement of the multicultural counseling framework. So orientation was developed as a way that's more closely aligned to the process-oriented language that we use as therapists, right? So it's similar to having a theoretical orientation, but it's a multicultural orientation. At the core of it, it's cultural humility. And then outside of that, the therapist needs to be comfortable talking about race and culture in therapy, which means openly acknowledging it and maintaining an attitude of curiosity when it comes to discussing those issues. And then finally, the third aspect of it is cultural opportunities, or initiating and taking opportunities to explore topics related to culture and identity with the client. So if an opportunity presents itself, you take it, but also you initiate those opportunities in therapy. And so some questions that you might consider when formulating your own initial discussion around race are listed here. It can make the process of discussing race a lot easier and more natural throughout the remaining course of therapy if you do it initially when you're first meeting a client. To help you think about how you might do that, you could think to yourself, how does culture influence the relationship between the client and the therapist? What are your most salient cultural identities? How would you explain these identities to the client? How would you invite clients to share about their own cultural identities? In what ways does culture influence clients presenting concerns broadly? How would you invite clients to explore how culture influences their presenting concerns specifically? And how would you inform your clients of your intent to explore culture throughout therapy? And so, I'd like to just take a quick second to check in with you guys. In what ways do you broach the topic of race and culture in your own work with clients? And as you're sharing that in the chat, I'm going to share with you a summary of what I like to say with my own clients during our intake process. So I say something similar to this. To help you understand me and my approach to therapy a little bit better, I'd like to talk to you some about my cultural background. Culture is an important part of the counseling process for many reasons. First, our cultural identities influence the way we see and experience the world. I identify as a heterosexual African American woman, and this may affect how I understand your problems. However, it's really important that I understand the issues you discuss with me during therapy from your cultural worldview as much as possible. And then I have a conversation with them about how they identify. So how do you identify your race, ethnicity, sex, gender, sexual orientation, religious or spiritual background? What are the most important aspects of your background or identity? After having that conversation, I let them know that at times I may ask how the aspects of your culture influence the problems you experience. Additionally, many people experience discrimination because of their cultural identity, which may also contribute to their difficulties. And in these cases, we may explore strategies to help you achieve a greater sense of empowerment, knowing that taking steps to address racism in one's environment can have a therapeutic effect in itself. Jim, I didn't know if you wanted to share any of the chat or if we should just move on.
Sorry, no, I haven't seen any chats, but I'll keep an eye on them. Yep.
Okay, great. So then, that is an example of how you might broach race initially during therapy. This is this shows how you might do it during the course of therapy. So we have here Andre, a 40-year-old cisgender African-American man who is seeking counseling due to feelings of anxiety and depression after being fired from his place of employment. Andre, who was employed as a plant supervisor, explained that he was fired from his job 1 month ago due to low ratings and back-to-back performance evaluations. Since that time, Andre has experienced an overwhelming sense of sadness and worry and has made little effort to find new employment. So then in terms of therapist dialogue, therapist says, it sounds like you're pretty overwhelmed by this situation. What goes through your mind when you think about looking for a new job? Andre says, I guess I just don't see a point. I thought I would do well as a plant supervisor, but as soon as I got the position, I started second guessing myself. Whenever my operations manager observed me on the floor, I had a hard time remembering things and had to ask for help. I don't know if I can handle being a supervisor, but my family can't survive on a lower paying job. It seems like things never work out for me. Therapist responds, Andre, I hear that you're feeling defeated in your search for a new job, right? So that's a typical counselor response. We reflect the content and the feelings that we hear in the client's statement. The client responds yes, but in the next response, you can see that this is where the counselor initiates that conversation about race. So she says, it also sounds like you felt so nervous when being observed by your operations manager that you even had problems with your memory. Tell me, how did your feelings in this situation reflect your experience as an African American supervisor at the plant? Right, so there's some recognition that African Americans in leadership roles are typically viewed as less credible. They have greater resistance from their supervisees. Knowing that, it made sense to bring up race in that context and to begin to explore it with the client. Okay, so then if you're thinking about, talking about race and therapy with your own clients, some strategies to reduce therapy interfering behaviors, or basically strategies to get you to not avoid it or to feel awkward while discussing these things. You can seek continuing education. You can examine your assumptions. You can challenge the idea of racism as a good, bad binary. So again, it's not about the person necessarily. It's not about what their intentions are. It's just about the impact. You can be open to feedback. You can apologize. If you do offend someone, rather than defend yourself, simply apologize. That can go a long way. And then you can also just remember to be curious and courageous. Again, it can be awkward, but if we take that step, even if you do it in a way that's maybe not as eloquent, the client is likely to appreciate it nonetheless. Okay. So then I want to Now I want to move on to that second aspect that we talked about in the therapeutic relationship, but then in terms of case conceptualization and treatment planning, I think that CBT offers a lot in terms of thinking about how race and racism influences the psychological distress that clients are experiencing, internalized racism in particular. We have that typical cognitive model that we think about when we're thinking about CBT. We have a situation, we have a thought, the thought leads to specific reactions, whether they be emotional, behavioral, physiological. But we also have those underlying cognitions like core beliefs, conditional assumptions. So those are attitudes or rules that clients develop to help them cope with that negative core belief. And then the compensatory strategies that we talked about a little bit earlier. These are some notes about CBT and its use with African Americans. Typically we think about CBT as being limited in its applicability to multicultural populations, but research shows that it is effective with African Americans. It's been effective for things like behavioral difficulties, anxiety, depression, PTSD, and suicidality. And it also, within itself, just naturally shares some tenets with multicultural counseling, like emphasis on personal empowerment, attention to client strengths, and affirmation of one's own sense of identity. Next, I want to talk to you about a cognitive developmental model of internalized racism. And this is what Jim talked about in terms of the paper that I had published last year, which you all can read if you're interested in it. It explores this with a lot more depth. So basically, this model explores the role of early life experiences and social influences on the development of core beliefs and conditional assumptions, and the consequential feelings that might come from that. This is a visual representation of the model. I know it's very small. I just wanted to include this so that you could see what it looks like. And then I'll show you the pieces broken up. So we have early life experiences, societal influences, and those together lead to the development of personal schemas, core beliefs, and conditional assumptions. Those are reinforced through exposure to interpersonal interactions that reinforce those messages of inferiority, shame, and powerlessness. They lead to the development of race-related beliefs. And then there's continued exposure, which then is seen in activating events. So it might be like an internal process where you're thinking about these things, or there might be some external stimuli that activates those beliefs, those negative internalized racial beliefs. Things like self-rejection and powerlessness. Those are experienced through cues from the environment, situations that we go through. They lead to automatic thoughts. Typical CBT model, you have certain reactions. It reinforces dominant beliefs, and then those again reinforce the initial negative racial beliefs that the person is dealing with. So I have a case study here. I think I'll summarize it for the sake of time, so I can just share a few more things with you all. This is Jasmine. She's an African American woman who is in a PhD program in anthropology. She has some interest in studying topics related to race, but she's been dissuaded from that by her professors and colleagues, with the idea that it might be better for her to explore something that's more generalizable for her career's sake. Personally, she's at work been characterized as sassy and standoffish and difficult to talk to, and as a result she experiences some reprimands at work and also some isolation from her colleagues. Okay. So she's presenting to counseling due to difficulties with depression and anxiety. This is a cognitive conceptualization diagram, which the bottom half looks at that typical cognitive model, so the situation, the thoughts, the emotions and the behaviors, but the top half explores those underlying beliefs that we talked about that lead to those automatic thoughts in daily situations. So for Jasmine, you could see her relevant childhood and social influences there, which we've talked about. Her core beliefs: I'm different, I'm vulnerable, I'm not good enough. So again, reflecting those aspects of internalized racism where there's some shame, there's some alienation, there's some self-degradation. Again, these in and of themselves don't necessarily scream out internalized racism, and it's important to be able for the counselor, the clinician, to be able to understand these things within the context of the African American experience. Her rules that she has developed to circumvent those core beliefs are: if I work hard, I'll be accepted. If I make a mistake, terrible things will happen. If I share how I feel, I'll be rejected. Some compensatory strategies: self-criticism, self-blame, conformity to social standards, avoidance, overeating, keeping her feelings to herself, being careful with words and behavior, joking. Okay. And then I want to skip that. Okay. So we talked about social influences, how that influences the development of internalized racism, and that was on the previous slide. I want to look here at some of the specific psychological phenomenon that might be related to her conditional assumptions, right? So she has this belief: if I work hard, I'll be accepted. That reflects a broader aspect of internalized oppression that all members of oppressed groups experience, namely belief in a just world, or the belief that people get what they deserve. And she also thinks that if she chooses the right dissertation topic, then she might earn acceptance from her peers, instructors, and those in her broader academic discipline. The next assumption she had: if I make a mistake, terrible things will happen. If I share how I feel, I'll be rejected. That's unique to her family experience in terms of the messages she received from her mother about being strong. But it's also related to coping strategies that are often implemented within among people who are experiencing internalized racism, right? So she feels hypervisible because she's the only African American student in the classroom. And as a coping strategy, she might defer to students, to white students. So then when she's doing that, she's criticizing herself for not being Black enough, quote unquote, for not standing up for the topics that she believes in. But she's also implementing those reinforcing behaviors of racism, in which there's this ideal that Black people may be less intelligent or less competent. So because she's withdrawing, she's not able to demonstrate her competence, and she's reinforcing that negative ideal. Okay. And so that's her cognitive model, which we kind of discussed. Here are some treatment goals you might want to think about specifically in terms of identifying the internalized racism. Simply helping bring awareness to the cycle of internalized racism would be necessary. And then helping the client to articulate an individualized set of values that's not based on imposed Eurocentric ideals or standards. So something that's more authentic to herself. And then also, as I mentioned, increase her sense of power or empowerment in decision-making related to her education and her career, really. These are some interventions. They're common to CBT, right? So you want to come to CBT and therapy, you want to broach the role of internalized racism. You want to assess her readiness to confront and challenge. Dealing with racialized trauma is just like dealing with any other kind of trauma. It takes time. So it's important that we don't push clients into thinking or doing certain things, but that we really are there to empathically listen to their emotional experience until they're ready to start addressing some of these things. You could teach her to challenge and modify automatic thoughts. You can implement behavioral strategies that promote consciousness raising. such as bibliotherapy, participation in campus or community organizations that affirm her identity. Again, understanding that research shows that a positive racial identity can be protective against internalized racism. You can help her modify core and race-related beliefs by completing a historical review of when and how these things developed, and identify new and more functional core and race-related beliefs, and then engaging in an ongoing process of finding evidence to support those new beliefs. So then thinking about modifying those core beliefs, here are some questions you could use to help deconstruct the ideas of race and internalized racism for the client. When did you first realize yourself as a racial being? What did being Black mean for you at that time? What are the advantages and disadvantages of being Black? What are the stereotypes associated with being Black? How did you learn these stereotypes? Where did these stereotypes come from? How do these stereotypes affect the way you see yourself and people in your racial group? What are some alternative explanations for these stereotypes? What would you like to believe about yourself outside of these stereotypes? And what evidence is there to support these beliefs?
Janae?
Yes.
Yes, I know there's more
It's 1
information,
o'clock.
but I see
Yeah.
folks, yes.
Yes.
And I have to say thank you for this wonderful presentation. A couple of things and we do have to end, but
Okay.
and I'm glad you're at mindfulness techniques only
Yeah.
because I see folks leaving. A couple of things. Obviously there's more to discuss here, and this is an amazing topic, and I want to thank Dr. Janae Steele for a wonderful presentation. Apologies, I wish we had more time, but obviously this is a topic that requires, and maybe in many ways we can have a follow-up. One of the things I want to encourage folks to do, because I see folks leaving, is please complete the evaluation of the session afterwards, and in particular give us ideas about what more you would like to learn. There is a lot here, and judging from the chats and comments that people made, this brought up a lot of thoughts and a lot of and provoked a lot of thinking among the participants in this webinar. So please let us know, and we would love to have Dr. Janae Steele back again, possibly, to do another offering that can address some of the questions that were raised. So we encourage you to complete the survey.
Yes.
Janae, I just wanted to ask if you had one final thought as folks leave the door. And
Yes.
yeah.
I want to thank everyone. I did not realize it was 1 o'clock already. This was like, I think there may be 2 or 3 more slides. So we did make it to the end, in case you're wondering. Thank you all for listening. Thank you for your engagement in the chat and the thoughtfulness with which you've approached this topic. It's been great to be here with you.
Thank you. And actually, to reinforce something that Dr. Steele mentioned, we will have the slides available. We will have a recording of this webinar available, and other things that folks mentioned. I think folks wanted a bibliography, which is, I think we can make available as well, on the website, on the CTAC website, within the next day or two. So thank you all for attending this webinar, and we hope you health and a great day.
Thank you.
Take care.